Hello, I'm Dr. Mira Irons, President and CEO of the College of Physicians of Philadelphia. Welcome to the latest in our series, College Conversations, Medicine, Science, and Society. Today, I'm speaking with Dr. Amy Goldberg, a college fellow since 2003. Dr. Goldberg is the interim dean of the Lewis Katz School of Medicine, the George S. Peters, MD, and Louise C. Peters Chair and Professor of Surgery, and the Surgeon-in-Chief at the Temple University Health System, one of the busiest trauma centers in the region. Welcome, Dr. Goldberg.
Hi, and great to meet you.
So, Dr. Goldberg, it's clear that gun violence is a significant problem in Philadelphia and other major cities in the U.S., and the statistics are staggering. Philadelphia has reached 127 homicides already this year, outpacing the number of killings this time last year, which in itself ended as the deadliest in the city's recorded history. The 562 homicides in 2021 broke the previous record of 500 killings reported in 1990. And these aren't things that we want to keep breaking.
They're not good records.
No, they're not good records. So, earlier this year, you made headlines with a tweet on New Year's Day, voicing your frustration over the escalating gun violence in Philadelphia. Can you tell us about what prompted that tweet and what the response to it has been?
Yeah, I think you said it perfectly. I was really just incredibly frustrated. It had been the last, 24, 36 months of just outrageous numbers of shootings and homicides within our city. And I woke up on New Year's Day and turned on the news and saw what had occurred overnight. And I was just outraged and wanted to express it and wanted to say, where is everybody? Where is your outrage? What are we going to do as a city to stop this? And just push send on the old tweet.
That's right. So, you made an important point in the Inquirer interview at that time, that followed that tweet, that attention to this issue shouldn't wax and wane. And, I think back to 2018 when physicians were told, I believe by the NRA, to stay in your lane. And many physicians, surgeons, trauma specialists, emergency medicine physicians took to Twitter with the hashtag, this is our lane. And it seems like here we are again in this situation. You're a very active Twitter user in general. Do you feel it's your responsibility as a physician to stimulate conversations around public health on this platform? And what kind of response are you seeing from your outreach?
Yeah, so absolutely. I think it is all of our responsibility as physicians to care about the health of the public. So that is public health. And to stay silent, I wouldn't want anybody to confuse that with acceptance or we're okay with it all. I think we have to express ourselves. We have to lead in this area because after all, this is how we're all trained. We are trained to care for patients and to care for our communities and to care for our society. I've heard a lot of response from people. People are outraged. And I think the trouble is that at times there appears to be so many competing priorities. And then people do get fatigued, and it's important to not become complacent or accepting. Maybe complacent is the wrong word, but really just accepting this as the new norm. How dangerous that would be. And I think that's why, I said something on Twitter. I think that's why docs back in 2018 were angered by the NRA being so condescending to tell us to stay in our lane when we were exactly in our lane. This is exactly what we're supposed to be doing.
Right. Can you tell us about the advocacy programs that you run at Temple to help curb gun violence in the city?
Sure. A number of years ago, back in 2015, I was so incredibly fortunate to hire Scott Charles, who is our trauma outreach manager. And if it really weren't for him, we would not have any of the programs that we have now at Temple University Hospital. And we first started with our Cradle to Grave program, which is really a prevention program. We feel that physicians and hospitals are the best educators as to what bullets can do to bodies, to exactly what gun violence is. So we developed Cradle to Grave to be that professor, to be that educator, because if we're not talking, if we're not teaching people what bullets do to bodies, then they're looking at the TV or on movies or video games, and they're seeing wrong information. You don't get shot and just pop back up. And we really felt it was so important that we be the educators. From cradle to grave, we developed our Turning Point program, which was more of an intervention program. When our patients are here within the hospital, what support services can we provide for them to help them when they go home? And really, our Turning Point program morphed when our grant support came into our Victim Advocates program, which we've now had for about 2 years. And 24/7, we have victim advocates that are in our hospital, that are embedded in our emergency rooms to help our patients, to help our patients' families, to help our physicians, our nurses, all of our staff in what we're seeing. If we have to go tell a patient's family that their loved one has died, we have the access to our patient advocates who have been trained to help us with those conversations. To when we get called away to have to take care of another trauma patient, they can stay with that family. They can also follow up with the police or provide what other services are needed there within the emergency room. But then even when we send patients home, we make sure that we then hook our patients up with the different victim agencies that are then in the neighborhoods that they're being discharged to. This has been the single game changer and has helped our patients so incredibly much. I'll give a little shout out to our Safe Bet program, which is just Scott Charles passing out gun locks, right? If you're going to have a gun, don't leave it unattended at home. You know, too many children are shooting themselves or shooting each other. So he goes all over the city passing out free gun locks. And then our Fighting Chance program, which is going out into the community and teaching first aid to our community. You know, what will kill our community, unfortunately, isn't going to be a heart attack. It's going to be being shot. That in itself is terrible. So what can we do? How can we help our community? Apply pressure to a wound, apply a tourniquet, make sure that you're getting out of harm's way. And we've been doing that for some time. So again, I'm incredibly proud that the support that Temple University Hospital has given us, to the really expertise and dedication of Scott Charles and all of our victim advocates that really help our patients and our patients' families every day.
This is all amazing. You know, I'm always a believer in sort of sharing programs of success, right? So are you sharing the programs that you're doing at Temple with trauma surgeons in other cities that are able to sort of follow the same models?
Absolutely. I mean, not only do we have a great community within Philadelphia that we all learn from each other, which we certainly do, but Scott and I regularly communicate with other trauma centers, sit on different panels. Nobody wants to keep this to ourselves. We all really want to learn from each other and really just do best practice.
Mm-hmm. Yeah. You know, because I think it is that everyone wants to understand what their lane is, right? Because you can be most effective in your lane. And so sharing this with other surgeons, trauma physicians, you know, it clearly is our lane, right?
Absolutely.
You know, it gives people a reason to do that.
A lane with no guardrails.
Exactly. You've experienced the impact of this gun violence personally as a trauma surgeon, you know, who cares for the victims, who speaks to the families in the emergency room, who sees what the community that is affected. But you're now also in a position to teach students as an interim dean. And how do you think about the educational piece of this? That's not in the OR, that's not in the emergency room, to students entering Temple Medical School. How does that layer onto that?
Well, you know, I think our students are so special the moment they hit the door because they want to be at the Lewis Katz School of Medicine. They want to work in this North Philadelphia community. So we don't really have to do anything to get them engaged. They are already engaged. They already understand the social determinants of health, and they already kind of throw themselves into doing anything that they can to assist in the community with regards to gun violence. So we're very fortunate. And there are times where they lead us, which is really spectacular, and the way it should be, that we're all really learning from each other. What I can do now in this role as the interim dean is really bridge all of the expertise in the hospital, what I talked about with Scott Charles and all of the work that he does, as well as across the street here within the Lewis Katz School of Medicine, where we have Dr. Kathy Reeves, who is an expert. You know, Marla Bellamy Davis is also an expert. So it is really what we're trying to do now is bring both sides of the street together and really share best practices on both sides of the street so that we can really help our community.
Great. the College of Physicians of Philadelphia sits at this intersection of medicine, public health, and the public, and has a very active section on public health. Given the longstanding history of the college in Philadelphia, what role do you think the college can play, either as a convener or other roles, to ultimately, contribute to reducing gun violence in the city?
Well, I think it's already what you're doing, where you have a huge public health branch of the college. I think the educational programs that you provide, because you'd be surprised, people don't know. So it really is important that you provide these educational programs, that you bring people together, as you said, as a convener. I think just your interview with me is incredible. And I know that there are other programs that the college does, whether it's certain grants to help students that are in high school progress on their way into sciences and things like that. So, I think the college is really at the forefront of really partnering with just about anybody, to help stem these problems.
Great. The pandemic has reinforced the need for physicians to have a better understanding of health equity, health disparities, and social determinants like gun violence, education, food deserts, and how all of that affects the health of patients, families, and communities. How do you think that medical school curricula should evolve to address those areas while still continuing to teach the science and everything else that physicians need to know? Quite often, medical school curricula is a zero-sum game, right? So you add something, you take away something else. How do you think about creating that right balance for students?
Yeah, I think it's a great question, so we have great technology now. So we have to utilize the technology so that it can be a zero-sum game, so that we can focus our energy on the community needs, educating our students on the social determinants of health. And everything that we do, we start very early with our students when we teach them in our doctoring classes with regards to, what is your diet at home? Right. And you just can't tell somebody with diabetes or somebody that's obese, well, eat a good meal. That's where you start introducing these food deserts. How incredibly frustrating is it to say to a patient, okay, make sure that you're eating a lot of fruits and vegetables, when they don't have access to that. And that's why it would be so wrong of us to not make a place for this in our curriculum, because our students will not be successful as physicians if they go out there not understanding the true significance of food deserts and housing insecurity and all of the social determinants of health out there. So we're going to use technology to be able to make some room for this other aspect of our curriculum, which is really quite vital and necessary.
That's great. So I always give people the chance to, any final thoughts, any final messages you want to get out there?
No, I think with regards to the gun violence within the city, I think it's just so important that at no point do we become accepting that this is the norm. By no means is this the norm. Just because, Anderson Cooper isn't on our block doesn't mean that there isn't a war up here, every day and every week. And this cannot be acceptable. And it truly lessens all of us as a society, as a community, as a city, that this is ongoing. And we have to, put our differences aside, provide the funding, understand that, poverty and much of these social determinants of health have led to this. And this is how we need to tackle it.
Great. So thank you so much for taking the time to talk today, Dr. Goldberg, and thanks to all of you for listening. We'll be back with another episode of College Conversations, Medicine, Science, and Society soon. Thank you.
Thank you.